following is a production of the University of Minnesota.
So it's really a real pleasure, I want you to know, to be a part of this, a part of something happening to bring about, if you will, a revolution of our sexual, dysfunctional society. The reason when you bring about a revolution, you have to remember that means that you're trying to change something. And the hardest C word in the English language is change. Our government needs to understand that sexual and reproductive health problems account for 18% of the total global burden of disease and 32% of the burden among women of reproductive age. So if we know that, you would think that we would start educating about sexual health to reduce the burden of disease, but we're still in that period of silence where we can't talk about it. We had the highest teenage pregnancy rate in the industrialized world. It went down 36% in black teenagers, 45%. Well, we decided, well, you know, we are going to have abstinence only, and you can't talk about contraception or anything of that sort. You can't talk about condoms. The only lesson you need to know about condoms, the condoms will break. Well, always remember that the vows of abstinence break far more easily than the latex condom. So let's deal with the real issue. And every mother I know, every father I know, every teacher I know, the most important issue that they want to do is they want to protect the most valuable resource they'll ever have. That's their children. And we've got to somehow find a way to educate our society so parents will be able to talk. We've got to make sure that our schools are teaching scientifically based, as Eli just said, age-appropriate, culturally sensitive sexuality education. And that's not what's being taught. Only 5% of the children in this country get that. So that is something that we've got to talk about. We as a society has got to change it. We've got to educate, educate, educate. We've got to eliminate all those myths that are out there. And we all know that there are plenty of them. Get rid of the stereotypes. We've got to be the voice and the vision of the poor and the powerless. Those powerless children in need of powerful friends. We have a responsibility for that. We've got to empower ourselves, our patients, and our community. We've got to be involved in public health and in things that we're talking about related to sexuality. It's like dancing with a bear. That when you're dancing with a bear, you can't get tired and sit down. You have to wait until the bear gets tired, and then you sit down. So we've got a bear that we're dancing with, and we're all trying to find new partners for this old bear so we can sit down. Thank you very much.
I think her message was really that we cannot ignore the fact that sexual health is part of a healthy human development and that it's a lifelong enterprise, and that really medical professionals, especially doctors, are really vital in making sure that the public gets good information and that they get access to not just information but also the means to sexual health. Which sometimes becomes such a political issue that really obscures the fact that people really are at risk, both of illness and disease, but also of having their life choices dramatically affected or reduced, like in the case of teenage pregnancies.
We need to change society's views in general as far as how we approach sexuality, being a little more open, maybe able to talk to our children easier and to have preventative measures more available, more open, especially in the schools, reaching the kids while they're in that environment.
Or like parents, like she said, don't believe that their kids are having sex, even when it's kind of obvious that they almost certainly are.
She's got a great presentation with her statistics, her evidence-based, in terms of teenage pregnancy, STDs, the fact that we as an American government are kind of ignorant to being preventive and proactive as opposed to just picking up the pieces after, the pieces have already fallen apart.